Morning friends, welcome back to my YouTube channel Medical Classes by Dr. Srinidhi Kumar Acharya. Don't forget to subscribe my channel and also please give your valuable comments. Now, in last few classes, we have been discussing about how to take the history, especially for the pediatric patient. Almost all I have posted some 16 videos related to history taking, very short videos. I hope you will get benefited by that. Now today, as a continuation of the same subject, so we will see how to do the diagnosis. Now we have taken all the history, and after taking the history, now we have to go for the diagnosis. Now most of the time we say that a good and a proper history will do almost 70 to 80% of the diagnosis. And the systemic examination and general examination is required only for the confirmation of the same. That is true also. If you take proper Prashna Pariksha or history taking, that itself is about 70 to 80% of your diagnosis. Only by systemic examination and some other investigation, if it is needed, you can go for the confirmation of your diagnosis which is made on the basis of the history. So, a very good history, a very detailed history itself guide you towards the diagnosis. Okay, and meantime, another way is if you follow the method of taking history as explained by me in the earlier videos, there is very less chance of deviating from the diagnosis. Otherwise, if your history is improper, and there is all the chance that your thinking direction may itself get changed. Okay, suppose you have not asked the onset, and instead of acute you thought it as chronic, or you have not at all asked, then what happens? The total diagnosis itself will going to change. So therefore, each and every point which is mentioned in the history taking is important. And suppose if you are taking such a good history, then it's almost all a diagnosis. But still, what you will do now after taking the history, now collect all the positive information which is given. That means positive points. What are all the positive points which you have got in the history? That should be collected in a place, starting from the vital signs and starting from the vital data, vital signs, and the present history, past history. What are all the positive things that you have got, the presentations or findings that you have got? So you write it in an order. Okay, now age of the patient, then 2 years, then comes the sex is male. Okay, then there is a consanguineous marriage. Yes, then there is a low socioeconomic status. Yes, then there is a occupation is a student or something like that. So write all the details in an order, and then comes what is the main complaint and what are the present complaints and what are all the findings are there. You write in an order and give them the technical terms. That means now the history taking is over. No need to worry about the technical and non-technical terms. Now whatever you do, that is in the technical terms only, medical terms only. So try to give some of the medical terms. For example, patient complaint is he is not able to walk properly and he is some imbalance etc. Now you can use the technical term there. Maybe it's equilibrium or maybe ataxia. Okay, such technical terms may be now used. Okay, then consider age of the child. Consider the onset and progression, and these all details we have mentioned. Consider the involvement of the system. Okay, then consider the presentation as a Pururupa, Rupa, Vyakta, Upadrava and Arishlakshana. In terms of Ayurveda, when we talk, suppose the presentation is there, patient may be coming to in the form of a Pururupa stage, may be coming in the Rupa stage, may be coming in the Vyakta stage, or may be coming in the Upadrava stage, and may be coming in the Arishlakshana stage. Suppose a patient of Shwasa is coming to you, dyspnea is coming to you. The dyspnea may be present in the patient as a Arishlakshana also, or it may be Upadrava or some other disorders, or it may be the Rupa also, or it may be Pururupa also. We don't know that. Okay, so therefore you go from the back side, reverse direction. First exclude whether it's Arishlakshana or not. No. Then see whether it's Upadrava. No. If it is not, then it may be Rupa or it may be Pururupa. So like this, anyway, you collect all the information. What I mean to say is you collect all the information. Now, a good history taking will itself complete the diagnosis, and physical examination is left only for the confirmation of the same. So it also minimizes the need of lab investigation. Suppose if you're not taking the good history, what happens? We have to rely more on the investigations, and many times we will go for unwanted lab investigation, which is a burden for the patient. Okay, so history taking should not be his story. That means it should not be a story Okay, what actually we want in history taking is we want the information of the disease part. Okay, so the information. Suppose the patient is telling vomiting, we want all the information regarding the vomiting, whether it is onset, is acute, or what is the progression, what is the aggravating factor, what is the relieving factor, what is the diurnal variation, what is the site, what is the color. So this is information of the vomiting. Now where patient is going, what he is taking, why he is going, where what the doctor is given, what he feels. So these things are history. This is a story. We don't want any story. We don't want any story. We want, we want the information about the particular symptom. Okay, so now onset of the symptom, progression and duration of the symptom, character, severity and aggravating and relieving factors, course and duration with the associated symptoms should be taken in each complaint. This part we have already covered in the chief complaint and the history of a present illness. Now come to the diagnosis. Now we have to give diagnosis. This diagnosis is based on the history only. We have not till touch the patient. We have not done any general examination, we have not done any systemic examination, and we have not done any investigations. Only we have taken a very good history. Now only you can do the diagnosis. But how to do that? So doing the diagnosis is always on 4 steps. If you follow these 4 steps, you never miss a diagnosis. Okay, you may not reach exactly at the diagnosis, but you will be on the same line. That means you are on the correct pathway. Okay. So sometimes you are not able to mention the particular disease, okay, exactly, but at least you can come near to the diagnosis. If you want further confirmation, you can go for the investigation, but at least you should come to a 90% of your diagnosis. Only 10% should be left for the investigation or systemic examination, etc., for the confirmation. Anyway, so usually after taking a very good history, the diagnosis will be made on these 4 bases. Number 1 is anatomical diagnosis. Another one is pathological diagnosis, another one is etiological diagnosis, and another one is functional diagnosis. Same thing is also explained in Ayurveda when you see the samprapti. Okay, there are different types of sampraptis are there. Vidhi samprapti, vikalpa samprapti, sankhya samprapti. Okay, then deshakala bala samprapti. So like this, we have explained that we will see in the next class. Another class we will deal it in very detail. So now, anatomical diagnosis, pathological diagnosis, etiological diagnosis and functional diagnosis. So these are very important for understanding that means to have the proper diagnosis. Now what do you mean by this anatomical, pathological, etiological? That we have to understand now. Anatomical diagnosis. First we will see the anatomical diagnosis. Now suppose you have taken the very good history and we have got a list of symptoms. Patient is suffering from cough, patient is suffering from fever, patient is suffering from breathlessness, patient is suffering from nausea, patient is also having body pain. Many symptoms are there, group of symptoms are there. Now first of all what we have to do is we have to attribute these symptoms to a particular system. Anatomically to the particular system we have to attribute. That means suppose if there is a group of symptoms are there, now we have to see that to which particular system of the body these symptoms are get related. Okay, so let us take the example to understand this. Let us take the example to understand this diagnosis, anatomical diagnosis. Now let us take the example and understand this concept very clearly. Child is coming with a breathlessness. Suppose the child is coming to you with the breathlessness. Okay, maybe dyspnea or breathlessness. Complaint of the mother is सांस लेने में दिक्कत हो रहा है बच्चे को. ठीक है, breathlessness. Now the anatomical diagnosis may be related with the respiratory system, isn't it? Because we know that dyspnea is most commonly seen in case of disorders related to the respiratory tract. But same dyspnea may be also related to the cardiovascular system. Okay, same may be also related to the central nervous system. Same dyspnea may be also seen in metabolic problems, and same dyspnea may be also seen in psychological problems, isn't it? So now we have to attribute the present condition to a particular system. Okay, so we cannot give the medicine without finding out which anatomical part actually the symptom is related. Dyspnea is there, you are giving some of the medications, maybe some of the smooth muscle relaxing drugs or something like that. But we don't know to which system actually it is related. So this is blunder. This should not be done, isn't it? Anyway, so therefore, whenever the symptom is there, try to identify to which particular system it is in referring. Okay. So for this, we want some other symptoms also. Now, even in Ayurveda also, it is very clearly said that identification of the particular part of the body or system of the body for which it is related is very important. Ayurveda says that first you identify whether this disease is related to Sharira or whether this disease is related to Mana. Again, Ayurveda says if it is in Sharira, whether this disease is related to the Shakha, whether this is related to Koshta, or whether it's related to Koshtangas, or Urdhva Vikaras, or whether it is Shira or Marmasthana, okay, or Upangas, etc. So, if it is Mana, again, if it is related to Indriyas, if it is related to Atma, if it is Mana or Buddhi, etc. That means now we have to locate a particular anatomical region from which this particular symptom is originating. That we will see. Similarly, patient comes to you with the vomiting, suppose. Similarly, patient comes. See, we have seen the last example, breathlessness. Breathlessness may be the number of symptoms, number of systems. Okay, disorders of the number of systems may lead to breathlessness. Similarly, disorders of many systems may lead to vomiting. Disorders of GAT may lead to vomiting. Neurological problems may lead to vomiting. Renal problems may lead to vomiting. Some of the functional problems will be also there which leads to vomiting. Some of the hepatobiliary problems are also there which leads to vomiting. Now, we have to identify anatomically. When the patient complains, I am suffering from vomiting. By taking the detailed history, you have to identify to which system of the body this particular symptom is related. Okay. So, if the breathlessness is there, you need to identify the anatomy first. Okay, now by the symptomatology presented by the patient, you confirm that this particular breathlessness, we are taking the example of breathlessness, and you have confirmed that this particular breathlessness is related to respiratory system. Okay, respiratory system. So now the anatomical diagnosis is respiratory system, because patient is also having cough, patient is also having then fever, cough, etc. is there, and now he is also started with the breathlessness. So there is no any cardiovascular system involvement, like palpitation is not there. There is no neurological involvement. There is no history suggestive of any neurological involvement. So we have concluded that this is only the disease. This particular dyspnea is because of a respiratory system. Now, once you identify that this is a respiratory system, your anatomical diagnosis is over. Okay, now this is a disease of a symptom is related to respiratory system. Now you have to identify the microanatomy. What do you mean by microanatomy? Now, okay, this is okay. This symptom is related to respiratory system. Which part of the respiratory system is get affected? That now, this is the next step in the diagnosis. This is called as microanatomical diagnosis. Anatomical diagnosis. Next comes microanatomical diagnosis. Now, dyspnea is there. The problem is with the respiratory tract. Which part of the respiratory tract is responsible for this dyspnea? Okay, whether it is in the upper airway, whether it is in the lower airway, whether it is in the tracheal region, whether it is alveolar region, or whether it is interstitial area, or whether it is pleura. Now you have to identify from the history only, not by examination, only by means of history, you have to find out this. This identification is called as microanatomical diagnosis. Now suppose breathlessness is there, we know that. Breathlessness may be also there in the upper respiratory tract because of some foreign body aspiration, etc. There may be, but it is not breathlessness, it is a gasping like movement. Okay, breathlessness may be there in the lower respiratory tract infection, and we know that cough will be there in the upper respiratory problems, and when the breathlessness starts, that suggests that pathology is moving into the lung parenchyma. Okay, so now patient is having a problem with the respiratory tract, and there is a breathlessness, and breathlessness is related to lung parenchyma. Now, lung parenchyma is the microanatomical diagnosis. Okay, so in this case, now we decided what is the anatomical diagnosis, total anatomical diagnosis. What is that? This is a disease of respiratory system involvement with the lung parenchyma involvement. And we know that in a lung parenchyma involvement, breathlessness is more, cough is less. That we know. This prior knowledge we should have. Okay, if there is only cough is there, definitely it is a disease of a respiratory system with the upper respiratory tract involvement. Okay, so if it is a cough, if there is a mild fever is there, and also dyspnea is there, or breathlessness is there, then this may be a pneumonia. Okay, so like this, now we are doing the anatomical and microanatomical diagnosis. This is the first step in the diagnosis. First step is anatomical or microanatomical diagnosis. The same can be done for the neurological system. Patient is having convulsion. Okay, patient is having convulsion. Now you have to decide whether this convulsion is related to which system of the body. Convulsion may come sometime because of the electrolyte disturbance. Convulsion may come because of some of the metabolic problems. Convulsion may come because of acidosis, etc. Convulsion may also come because of neurological problems. Okay, sometimes convulsions may be also psychological, sometimes. So first you have identify what is the anatomical diagnosis. Anatomical diagnosis, for example, this is nervous system. Now in the nervous system, again you go for the microanatomical diagnosis. What is microanatomical? Whether this is a central nerve system disorder, whether this is a peripheral nerve system disorder, or whether this is an autonomic nerve system disorder. Okay, we decided that this is a central nerve system disorder. If it is a central nerve system disorder, again divide this is related to the white matter or whether it is related to the gray matter. Convulsions usually are seen in gray matter disorders. So now this is a disease of a nervous system, neurological system with the involvement of the central nervous system, especially the involvement of the gray matter. Now in the gray matter, again you decide whether this is gray matter of the cortex, gray matter of the basal ganglia, gray matter of the cerebellum, or gray matter of the midbrain. So now this is called as a microanatomical diagnosis. So suppose if convulsion is a problem, I will come with the conclusion that this is a disease of neurological system with the involvement of the central nervous system, with the involvement of the gray matter of the brain, with the problem in the cortex area. So this much of information I am able to gather, or this much of diagnosis I can do simply by history taking. Therefore I am telling history taking is very, very important. So this is all about anatomical diagnosis. Okay, so this is the first step. Ayurveda also says the same thing, Sharira and Manasa. Okay, in the Sharira again they comes with the Shakha, Koshtha, Marma, Asti, etc. Okay, in the Mana again, whether it is Atma, Mana, Indriya or Buddhi, at what level actually it is affected. So this type of diagnosis even we can do in Ayurveda also. So thank you very much. In the next class, we will go for the second important way of diagnosis based on the history, that is pathological diagnosis. Thank you very much. We will meet again. Don't forget to subscribe my channel and also please give your valuable comments. Thank you very much.